Joining me now from San Francisco is Dr. Alok Patel. He's a medical journalist, a media correspondent, and a pediatric specialist. Dr. Patel, I got to start with what's happening in Texas and Mississippi. Despite CDC warnings, they're lifting mask mandates, rolling back restrictions. How concerned are you?
Asieh, I'm very concerned, not only with what's right in front of us, and that's a plateau in decreasing cases, rising variants. I'm also concerned over the fact that still 1 year later, there's still obviously a political influence in how we're approaching the pandemic and what governors are prioritizing. And I think it's also sending a terrible message to citizens, not only in Texas and Mississippi, but all over the country. We are not out of this pandemic yet. You know, these governors are celebrating in the third quarter of the game. And that's not what we need to be doing. It's a dangerous step forward, and there's concerns from private citizens to medical professionals to public health experts all over the country.
Let's put up a tweet by Mississippi Governor Tate Reeves, and this is what he says. That he tweeted this yesterday. Starting tomorrow, we're lifting all of our country mask mandates, and businesses will be able to operate at full capacity without any state-imposed rules. Our hospitalizations and case numbers plummeted, and the vaccine is being rapidly distributed. It is time, he says. And you would say, Dr. Patel, it is not time.
And I would say, I would ask him directly, it is time based on what data? So what he's citing right now is a decreasing amount of cases, but we still have a lot of cases. 2,000 deaths per day is not something to celebrate. He's also talking about the distribution of vaccines. We are not at herd immunity yet. If you look at Texas, about 7% of their population has been vaccinated. That's nowhere near the 75% goal. Mississippi and Texas actually are in the bottom 40 if you rank states according to vaccination rates. And also when Texas and Mississippi governors say things like, we now have treatments, our doctors can take care of COVID, that's ignoring the fact that we can very quickly overwhelm our healthcare systems if people continue to get sick. And not to mention the fact that we don't know what these variants are going to do in the next few months. There's 100 reasons, Asieh, why I'm frustrated right now.
Okay, let's switch to some better news. President Biden says by the end of May, there's enough vaccines for every adult who wants to be vaccinated. They can be vaccinated. The initial timeline was July, now it's end of May. Dr. Patel, is this realistic? Are there enough vaccines for everybody who wants to get vaccinated?
I think it is realistic to have the supply. You know, especially with what we've seen with the manufacturing of the Pfizer and Moderna shots, and now with what's happening with the Johnson & Johnson approval, the merger between Merck and Johnson in terms of distribution. But again, I stress to everyone to understand that we're just talking about the supply. We still need to make sure the vaccines are distributed and people actually get the needle into their arms, and that requires a lot more of a complicated process. And, you know, states are going to have a lot of responsibility, especially when it comes to equitable vaccine distribution and making sure those vaccines get to all communities, high resources, low resources, rural areas. And we're also getting people who may have barriers to getting shots, technological barriers, disabilities, all of it. We need to get all Americans vaccinated, not just be focusing on the actual supply.
And how much of a game changer is this merger with Johnson & Johnson and Merck?
I think it's a really good signal that companies who used to be competitors are now coming together to go after a common goal. And a lot of people are comparing this to the competition that turned into collaboration during World War II. Now, with respect to what's happening with the Johnson & Johnson vaccine, Merck has dedicated 2 facilities to kind of making sure that they can finish up the Johnson & Johnson supply and distribute them in something called the fill-finish process. And I think it's a great step forward in just seeing that how manufacturers can come together and just make sure we're getting vaccines out as quickly and efficiently and safely as possible.
You mentioned your concerns about these new variants. We have one from Brazil, South Africa, UK, and there's also homegrown variants that have raised flags in places like California, where you are, and New York. Can these vaccines, Dr. Patel, protect us against these new variants?
Well, as of right now, Asieh, the vaccines do protect us against severe illness or death, even when they were put in trials against the variants. So the Johnson & Johnson trial was put in places where there was both the South African and the UK variant. Now, this could all change in the future. We could see more variants, especially if we let the virus keep replicating, which is why multiple vaccine manufacturers are now in trials trying to see if they need to create a booster shot. But one thing I want to add, Houston Methodist Hospital put out a study showing that that is the first metropolitan city in the United States to have a case of all 4 variants, the ones you just mentioned. Yet another reason why we can't celebrate right now, we can't ease restrictions.
All right, we'll have to leave it there. Dr. Alok Patel, thank you so much.